Hello everyone, I'm Dr. Ashwani. Today we are doing axillary breast removal. She has axillary breast on both the sides. This is the right side and this is the left side. Okay, so we are planning a liposuction for her. We'll remove all the fat which is present inside the skin, inside this axillary breast area, and then we see if there is some extra skin, we might give a cut. Otherwise we will just leave it with a liposuction. Okay, she is also interested in getting the arm liposuction done, so you can see the saggy part in the posterior half of the arms that we are going to target today. Okay, so let's do her markings now. Procedure start करते हैं. Hello everyone, so we are started with the procedure. We already infiltrated this arm area with humescent fluid. Now we are doing the liposuction part. Then we will do the axillary area for the axillary breast. This is a simple cannula which goes in through the hole. The entry point that we make are in hidden places. You can see we are going through the elbow region right now. This entry point stays hidden in the elbow crease, so it is not visible. Procedure remains completely scarless. So we are finished with the case. You can see the huge axillary breast that was present has been removed through a tiny cut here. Similarly, you can see on the other side the axillary breast filling is completely gone. Okay. So simple liposuction can remove your axillary breast up to grade 2 without any big scars.